According to the CDC, someone in the United States has a stroke every 40 seconds. The good news is that about 80% of strokes may be preventable. In this week's Health Talk, we'll discuss ways for you and your loved ones to reduce your risk of stroke. Our guest is Michele Lecardo, Stroke Program Coordinator at Norwalk Hospital. Hello, I'm Dr. Eric Nazer. On this week's Health Talk, we're going to discuss ways for you to reduce your risk of stroke. Our guest is Michele Lecardo, Stroke Program Coordinator at Norwalk Hospital. Michele, welcome back to Health Talk.
Thank you.
Michelle's been a frequent guest on Health Talk, and she's a great guest on Health Talk.
Thank you very much.
This is such an important area, Michele. And
really is.
boy, it's an area where the world has changed. Was saying before that stroke used to be one of those terrible, tragic things that just happened, and we didn't prevent them, we didn't know what to do with them, and people just had the strokes and either died or lived their life with a disability.
Yep.
The world has changed.
Yes.
So we're going to focus on stroke prevention today.
Perfect.
So, okay, I'm an old guy. Maybe it's too late.
Stop it. No, it's never too late.
Too late to prevent.
It's never too late.
So what should all of us be doing to help prevent a stroke? That's the best treatment.
It is. Stroke prevention really over the last couple of years has really become our huge focus. And a lot of people still today, for whatever reason, they don't understand what risk factors they have. And a lot of it is if you have certain risk factors, and we'll go through those, but knowing your personal risk factors. If you have high blood pressure, keeping that under control, and going to a doctor to get your blood pressure checked. So many people—
Blood pressure, okay, you're going to say it. Go ahead.
So many people don't even realize that they have high blood pressure because there are no symptoms and they've never even gotten it checked to see what a baseline is. So understanding that you need a baseline blood pressure to truly know how to manage.
Michele, I'm just going to stop you there just because my children are now entering middle age. They're in their late 30s and early 40s.
Yep.
When should people start to think about this? Because I'll be honest with you, my own children, I'm having a hard time convincing them, go to a doctor and get your blood pressure checked, get your cholesterol checked, and you may need to start treatment. But when should people start doing this? I think they're already too late.
In my opinion, it should be in your 20s. We all should have an adult checkup for preventative medicine. There's so many things out there that we could actually control and change. A lot of people who are diabetics don't even know they're diabetics because they haven't been worked up to see if they're pre-diabetic. And by the time we catch it, it means you've already had an injury or an insult. You've already been in the hospital, and then we tell you these things. The whole point is for you to follow up with a physician for your pre-checkup. Think about it as doing a routine maintenance on your vehicle. We do routine maintenance on our cars so they last a long time. We should be doing routine maintenance on ourselves so we last a long time.
And it's so true that during kids, I think most parents are pretty vigilant in bringing their kids to the pediatrician and getting their vaccinations and getting them cared for. Somehow when you get out into your 20s and 30s,
we forget.
You become immortal and you stop seeing your doctor. And I'll speak personally. My father had heart attacks when he was young. He had one at age 58. He had another one in his 60s. And he was a smoker, which is a big risk factor. But he also had high cholesterol. At age 40, I saw a doctor here in Norwalk, who was one of my good friends, and I had high cholesterol. He started me on a statin, which I've been taking for over 30 years. And, you know, God, I am healthy. I've never had a heart attack. I've never had angina. I've never had any symptom of vascular disease. And I credit that doctor from when I was 40 for starting me on the right medicine and keeping me healthy. So again, you're not too young out there to be taken care of. And this may have, you know, again, we talk about cardiovascular disease, we're really talking about stroke and heart disease.
Yes, and they both truly go hand in hand. And that's something that I don't know that people truly understand. When we talk about stroke, we are also talking about cardiovascular disease. So these preventions, knowing these risk factors, actually are preventing you from having a heart attack and a stroke. They're keeping you clean so that you don't have those things come up.
Just to use they help prevent both treating blood pressure and cholesterol. They help prevent hardening of the arteries, arteriosclerosis, because damaged blood vessels are what can lead to both of these.
Yeah.
There's one thing that's a little different in stroke, and I think we ought to talk about it. There's certainly a lot of time on television given to this because there's so many medicines to treat it, and that's atrial fibrillation.
Yes.
Do you want to? That's really common. Do you want to say a few words about that and why it's so important to treat?
And atrial fibrillation is an irregular heart rhythm. And truly, it's been around. There are some people out there who have AFib. They live with it on a daily basis. But that is a high risk factor of stroke, because with that rhythm, the blood gets time to clot. And that's why most people who are on AFib take some sort of anticoagulant. A lot of people don't like taking that because they'll notice bruising and things like that on themselves. But don't ever take yourself off of it unless you're under a physician's advice. It does put you at a higher risk for stroke, to throw a blood clot to the brain. And the only thing that we can do for preventative of that is to treat your AFib, to make sure you're compliant with your medications so that you don't throw those blood clots.
Right, there's some different ways we can treat AFib. So there's some, depending on the circumstances, somebody can put your heart back into a normal rhythm, and that can help prevent the blood clot. There are relatively minor surgical procedures to sort of clip off that part of the heart where the blood clots form. But the most common thing is we put people on blood thinners.
Medication.
And that can reduce the risk of stroke, I know, from
significantly
6 to 8% a year all the way down to less than 1%.
And that really is something that I understand patients not wanting to be compliant with that medication because it is difficult to be compliant with, but AFib is one of the highest risk factors that we probably have the most difficulty in controlling because of the compliance that it takes on you as the individual.
And you may or may not know you have AFib. Some people will experience palpitations or other heart rhythm disturbances. Some people may experience nothing.
Exactly.
So the only way to tell for sure is to get a cardiogram. But as someone who has irregular heartbeat, I do have it. I can feel it when, and I don't have AFib, but I have an irregular heartbeat, and I can feel when my heart is not discharging. It just feels a little bit like there's a pause, and then you get another one. So if you're feeling that,
go see a physician.
Go see a physician. The other thing, just to throw out, some of those monitors that you could use
all the time now,
they work.
Yes.
I actually I bought one because a cardiologist recommended it to me, and they really are a good way to record your heart rhythm. And if it's a clean recording, a doctor can really use that to figure out what's going on with you.
And I think that's a really good point. You know, with it being the COVID pandemic era, a lot of patients are very afraid to go out into the community. It's something that has changed the way that we think and do things. And I think technology has helped us with that. So if you don't want to do certain things because you don't want to go out, get a blood pressure monitor cuff at home. Check your blood pressure at home.
That may be better because a lot of people will have white coat hypertension, which means that they get scared when they're having it done.
So there's a lot of things that you can actually do now at home that you don't have to go outside for, but it's still something that you're checking. The biggest suggestion is go to your physician, get a physical. All the risk factors for stroke are covered in a physical. So we monitor for high blood pressure. We check you for diabetes. We consult you on if you're a smoker, how to quit, and try to get you into a program. We talk about if you're obese. We talk about physical activity. We talk about if you have AFib. All of those are modifiable risk factors, meaning that you as the individual have control to change them.
And that, I love the way you say that because it really does make your health much less random, especially when it comes to things like stroke and heart attack. These are things we can control with the help of our health professionals.
Years past, people like, oh, my mother and father had a massive stroke, so I'm going to have one. Years ago, absolutely, that put you at a higher risk for having cardiovascular disease. Now we have technology, we have treatments that while that still is a risk factor, I can't change your age, I can't change your gender, I can't change your past medical history with your family history, but I can modify your individual risk factors to decrease your risk of stroke.
And probably point out things like smoking, there are medications that help. There's some very exciting things going on in weight control. I don't know whether you're using them yet, but New England Journal's had a couple of very exciting articles about medications that are very effective in helping, and not the old kind, but a totally new approach. So weight loss surgery has come a long way if necessary. So there's some real things that can be done that are better than we'll try harder.
Yes. Treating stroke now truly has become, I hate to use the word fun, but it's something that people have become passionate about because we've actually seen improvements in patient care, in patients that we're able to treat and offer to get them back to a normal quality of life that we weren't able to do before. It was a very depressing disease.
Yeah, it was very much so.
It was very depressing for the person, the family, and the caregivers. Now, if the individual takes responsibility, works on their own risk factors, we as caregivers have better options to treat you, and you get back to a quality of life.
Do you have any sense, and you may not, because I'm not sure this information's out there, but if people ideally control their risk factors, how much we could reduce stroke in general?
I don't know how much information's out there, but they do say that 80% of strokes are. So I would tell you that if we controlled them, while I don't know if I could promise you won't have a stroke, what I can say is by controlling those risk factors, the stroke you have should be mild and considerate to what would happen if you didn't control them.
And you can't tell me that I'm not going to get hit by a car when I cross the street, but if I cross at the corner and I stay on the sidewalk and I follow the lights, I reduce my risk of getting hit by a car. And I think that's all we can do in this world is control our risk. We can't do things absolutely. Anything else that people should know about preventing a stroke, or maybe even early recognition of stroke? We're starting to run out of time.
Early recognition of stroke, the one thing that I'd love people to remember is be fast. If you're home with someone who's an individual, just say to yourself, be fast. If my balance is off, if my eye vision is blurry,
or double,
if I have facial swelling, or when you start to talk to me, it kind of looks like I'm
almost everybody knows that look, but it's very characteristic that one side of the face will droop and that side of the mouth won't work.
And if I look up my arms, if I have any arm weakness in one side, even if it's just numbness and tingling. Speech, if my speech isn't clear or off from what it was, you need to call 911. And time is brain. A lot of people still fear calling 911. It has this certain stigma, but that is the best way to get treatment. And I rather see every patient that I can treat in a certain time frame than those that I can't.
Will 911 automatically take you to a stroke center?
Absolutely.
Because there are centers where people are equipped to handle this. I know that here in Norwalk, there'll be a stroke alert if something
Early activation with 911 gets the hospital ready for your arrival. If you drive
people
in your
may not
car,
realize that.
Right.
They will call ahead, and we've run out of time, but it's so important to
It is. Call 911.
Michele, thank you. Thank you so much. That's all we have time for today. Be fast. We want to thank Michele for joining us on Health Talk, and thank you for watching. Please share your comments and questions with us by emailing us at healthtalk@newvancehealth.org. We'd love to hear from you. Take care.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. I'm coming back. Ask your doctor, check your blood pressure.
Stroke is one of the leading causes of death and serious disability among adults in the United States today. However, you should be aware that stroke may be preventable, and if caught early enough, often treatable. On today's Health Talk, we'll discuss ways to identify stroke symptoms and get treatment quickly. Why? Because when someone comes to stroke, time is brain. Stay tuned for more with Michele Lecardo, Stroke Program Coordinator at Norwalk Hospital. Hello, I'm Dr. Eric Mazer. On this week's Health Talk, we're going to discuss ways to identify stroke and get treatment quickly. Our guest is Michele Lecardo, Stroke Program Coordinator at Norwalk Hospital. Michele, welcome back to Health Talk. It's so good to have you. You always have such great advice for people at home, and it's so practical, and it's so universal. We're not talking about rare disease here.
We're talking about stroke.
We're talking about stroke. And do you want to say a little thing? Stroke has really, the treatment of stroke, the identification of stroke has really changed since you and I were little.
It has.
And I'm older than you, so since I was little, you were middle aged. Whatever. No, maybe I have that backwards. Go ahead.
But there's a lot of things on the stroke platform, if you want to say, that truly has changed. One, we're seeing stroke in a lot of younger individuals. So
do we understand that?
No.
Is it obesity? Is it smoking?
Obesity, smoking. I want to tell you that truly it's because young individuals don't get their risk factors checked and they have uncontrolled high blood pressure, in which they didn't know they had, or they have early stages of diabetes, which they didn't know they had, or they're smokers. So a lot of times those are the three big things, but we are seeing more stroke in young individuals. So a lot of what we try to do now is tell people these are the things you need to remember if you're having some sort of symptom of stroke. And those symptoms, there's like 10 symptoms that they talk about with stroke. But our mantra that we go by, or our nomenclature, is be fast.
This is an acronym.
It's our acronym for be fast. And truly what we want you to do, that if you are having any issues with balance, these are all sudden.
Exactly, that's important. Doesn't mean you've tied one on the night before and you wake up and you're a little bit groggy and
this is a
you're
sudden
there,
change.
and suddenly you are off balance.
Right, this is a sudden change, and it has to do with balance, eyes, blurred vision, double vision. Fast, meaning facial weakness. It could be drooping of the face, or it could just feel that you have facial weakness, or you went to eat something and it kept falling out the side of your mouth. That's facial weakness. We talk about A, from arm weakness. A stroke will never be that both arms are weak. It will be one-sided.
That's an important point, that because of the anatomy and because one side of the brain controls the other side of the body, when stroke occurs,
we talk about it, it's one-sided.
Usually one side. It can be a little bit more complicated because sometimes you can have one side in the face and the other side in the legs.
Yes.
But it's usually not, oh, both my arms are really tired.
No.
Or both my legs. That may be another problem, but
right.
It's not generally a stroke.
With stroke, it's always one side. It could be arm, it could just be leg, or it could be both. But knowing that it's on the same side of the extremities. When we talk about speech, this gets very confusing, especially because we have a lot of people who have a lot of different dialects. So understanding the speech is to you. So if your speech isn't your normal clarity, then that is a problem. Or if you're having trouble speaking in general. So it's not only getting the words out, but it's how are the words coming out? Is your speech really garbled? Is it normal for you or not?
And it may be others that pick this up, not just you.
Exactly.
Because the speech centers are pretty interesting in the brain, and you may not really understand that what you're thinking is not what's coming out of your mouth. Or, I mean, it can be strange too, where you can hear somebody speaking, but you don't understand what they're saying.
Exactly.
So the speech can be followed up in very specific ways, but any speech problem.
Any speech problem. And then T is time. The biggest thing that people need to know and that they really need to understand and embrace is that you need to call 911. If you have any of these symptoms, it is never okay to drive into the hospital. Your timing.
You want to say that again, because I think that's so important.
Time is brain. You will never get to the hospital and get treated quicker by driving in your car than if you call 911. And the reason being is 911 will pre-activate stroke alerts. That's where the system starts, is with EMS. And
So
goes all the way
EMS
through.
will, first of all, will call the stroke center that's nearest them, tell them I have somebody that I'm picking up who is having symptoms of a stroke, and the stroke center does things to get ready to receive them
And EMS
so that
will
they can go through
already-
quickly.
Right, and EMS will already start the stroke workup. So you're getting treated in the ambulance on the way to the emergency department, to where if you just drove, you're getting treated in the emergency
Yeah, I
department.
think a lot of people don't realize that an ambulance is not simply a fast car with a light on it.
No, they'll check your blood sugar, they'll check your blood pressure. They'll start to do things like the EKG on stuff that will cost more time that we would have to do in the emergency department if you drove yourself.
And they can be in touch, or they are in touch.
They are in touch.
With the emergency department. So you've already got that dialogue going. So when someone rolls through the door, people in the emergency room will know about them.
Yep.
They'll have things ready for them, and they may have offered advice to the EMTs, or just gotten enough information so that they can directly address what's going on.
Exactly. When EMS brings the patients in, then we can get you to CAT scan and do our things much quicker and save time.
And talk a little about time, because in the old days, time didn't mean anything. You know, if you diagnose my stroke tonight or 2 weeks from now, it's the same outcome. That's not true anymore.
Not anymore.
And with time, what we're really talking about is the time from the onset of symptoms to the time when treatment is initiated.
Exactly.
So that's the time we want to be as small as possible.
Yep.
So tell us about why is that true?
So time is all about, like you said, the time of onset of symptoms to the time of treatment. There is medication that we can give you up to a certain time frame, and currently that time frame is out to 4.5 hours from symptom onset. So if you have these symptoms but delay coming to the hospital, delay calling 911, you might arrive too late.
And it's not because there's somebody just made a rule.
No.
Well, why is it that at 4.5 hours we stop giving that medicine?
Because all the studies prove that after that limit, your chances for bleeding increase.
And a lot of the stroke is
already
completed.
survived. Yeah.
Yeah, tell us a little bit, why the thinking has really changed about stroke. We used to think you have a stroke, it affects part of the brain, that part of the brain dies within minutes, and there's no recovering. We know that's not true anymore. Do you want to say a few words about why can we recover from a stroke?
So I kind of like to put it into your plant, right? So if I'm planting and I have flowers, I know that sounds crazy, but think about it. If I have flowers and one plant, one of those stems is what dies, if I get rid of that, I'm trying to save the rest of the flowers. But I can only do that if I can treat that area. So with the drug, what happens is I'm never going to fix the part of the stroke where you actually had the stroke. I'm trying to save the rest of the brain. I don't want that death or that injury to expand. So it's all about
we have
expansion.
learned, and I think this was really seminal in our approach to treatment of stroke, is we learned that when you have a blood clot, which is the most common kind of stroke, the direct area of that blood clot, the brain dies within a few minutes. There's not much you can do about it, and you're stuck with it.
Save the
but there's a
rest.
whole area around there
Yes.
that is getting borderline blood flow, and it's hanging on by its fingertips, trying to survive. It can only survive for so long, and then it dies, and you can't affect that either.
And the medication will go in, and a lot of people like to refer to it as a clot buster.
So bam, it opens up the
It
clot.
opens up and it allows blood flow to get restored, and then that area that was at risk now is saved. And it limits.
And that can be very substantial.
Absolutely, because it limits the disabilities that you could have from your stroke. So it keeps your stroke on a smaller level with hopefully smaller deficits.
And this is sort of amazing because also when these studies have been done, and I remember reading them, and it can be from the dramatic, where somebody has a weak arm and they can't speak, suddenly they are
Awake and talking.
awake. Or it can be, you look down, weeks down the road, somebody who would have been disabled is able to recover slowly.
Yeah, because of physical therapy and treatment, post-treatment.
So some of that brain tissue may take time to
come
heal,
back.
but at least it can heal.
Yep. We've given it the opportunity to heal.
Because the blood flow's been restored. So the trick is to restore blood flow
In a very timely process.
and so the time is important, so we can save as much brain as possible. The common problem of somebody waking up with stroke symptoms. You want to say something about
So
that?
we've been able to.
So I don't know when this started.
Right.
You know, I went to bed at 10 o'clock last night, and it's 7 o'clock in the morning, and my arm doesn't work. You know, is it too late for me?
So no. I'm going to tell you the short answer is no. You still need to get to the hospital. We will do certain testing, but you won't get medication. But there is now what we call endovascular treatment, kind of like when you're having a heart attack and
This
they go
is
in
sort
and
of
take
the
out the clot.
fanciest stuff I've ever heard of.
It's very exciting. But kind of like when you have a heart attack and they take you to the cath lab and people, the community knows about these stents that are placed.
Right, the angioplasty we've heard of.
That type thing. Well, we're now kind of doing that same type of technology in the brain, where they're actually going in, and if it is a clot that is retrievable, they're going in and retrieving that clot, getting rid of it, restoring blood flow that way, and this way we're minimizing your disability of stroke.
Now, that sounds absolutely dreadful when you point at your head and say they're going to take the clot out. Do you want to say the way it's done is almost magical?
Yes,
What's
it's
if
all
you-
endovascular. So they literally go through a groin, or they might go through your arm, and they take catheters. Technology's improved so much that we take catheters. The neurosurgeons, interventional radiologists, who's ever doing these procedures will go up. They follow all the way up into the brain to that precise area, locate that clot, and then suck it back out, take it all back down, and blood flow is restored. It's absolutely
Truly
amazing.
And it's amazing that we're able to manipulate catheters. I mean, somebody walks out with a Band-Aid
Yep.
on their wrist after having this procedure that's taken a clot out of their brain.
It has totally revolutionized what we do in neurosciences, to the point that if you were that same individual 20 years ago, you wouldn't have lived very long, because we couldn't have treated you, and you would have died of pneumonias or things like that, or complications of your stroke. We probably all have loved ones that we've lost to that. Now we actually can give those loved ones a chance.
It's extraordinary.
The big thing that I ask is it takes participation from the community to call 911 and get yourself to a hospital.
And to the right hospital, because there aren't centers that don't offer this.
Yep.
I think Norwalk is a stroke center. Is Danbury a stroke center?
Danbury is also a stroke center. So we do have community hospitals that do have this, but EMS knows who's
And
doing
that's the-
what level of treatment.
And that's why you
EMS
should
will
call your EMS.
assess your disability and take you to the right place.
And Michele, on that note, we have to stop. It's very exciting. This is really great stuff. Unfortunately, that's all we have time for today. I want to thank you, Michele, for joining us on Health Talk, and thank you at home for watching. Please share your comments and questions with us by emailing us at healthtalk@newvancehealth.org. We'd love to hear from you. Great show. Stay well. Get your blood pressure and cholesterol checked. Please stop smoking if you do. Bye-bye.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
(145/92).
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself. I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life. But I'm gonna make it better. I'm coming back. Ask your doctor, check your blood pressure.